Hoffman. I'm Kayla. I'm going to be your postpartum nurse. How are you feeling right now? Do you have any pain?
I have a little bit in my bottom, but it's nothing too bad.
And how are you feeling about your baby right now?
I feel really good. I'm super happy, and I think we've bonded pretty well so far.
That's great. Okay. I'm going to wash my hands, and I'm going to clean my stethoscope, and then we're going to listen for your vital signs. Okay, first I'm going to put your blood pressure cuff on, and I'm going to put your pulse ox on so I can get your heart rate and your oxygen levels, and then I'm going to check your temperature. And your temperature is 97.8. Your blood pressure read 120/80. Your heart rate is 94, and your pulse ox 98%. And your respirations were 18. I'm gonna listen to your lungs now. Breathe in. Breathe out. And in. Breathe in. Breathe in and out. Okay, now I'm going to listen to your heart sounds. Your aortic, pulmonic, second pulmonic, tricuspid, and mitral. Now I'm going to listen to your lung sounds from the back. Breathe in and out, in and out. And I'm going to assess for CVA tenderness. Do you feel any pain?
No.
Okay. And what would you rate your pain level again?
A 3.
Okay. So the next thing I'm going to do is assess your breasts. How do they feel right now?
They feel okay.
Do they feel soft?
Yeah, they're really soft. Breastfeeding is going fine. I've noticed that he's opening his jaw, it's moving up and down, and he's swallowing too when he's breastfeeding.
Okay, that's great. Okay. The next I'm going to assess is your uterus. If you could please move back. And when I palpate it, it is firm. And your loci are earthy. There's no clots. There's redness, and there's nothing abnormal. And for your bowel, have you been emptying your bladder and bowel?
Yes, I've gotten up 3 times in the past hour.
Okay, and can I roll you on the side and check for hemorrhoids? And there's no hemorrhoids. And I can see the scar from the episiotomy, but you said it's at a pain level of 3 right now?
Yes.
Okay. And I'm going to assess your Holman sign. So, do you feel any tenderness in your calf?
No.
Okay. And I'm going to check your reflexes. There. +2 and no clonus. Perfect. And lastly, I'm going to assess your emotional level. How do you feel currently about your baby? What is your relationship to him right now? Do you feel bonded?
I do. I feel really bonded. I feel like we've had a really strong connection ever since that first time I held him. It's there, it feels like a great connection.
That's perfect. But I'm going to talk to you about after you go home, if you feel a disconnect from your baby, if you feel distant from your family, or any signs of sadness or feeling away from the world, then you come and tell your doctor, because that might be postpartum depression, and that's a serious thing. And I assessed your skin, and I noticed your linea nigra is still present, and you have some stretch marks. You have the chloasma, which is the mask of pregnancy, but all of this will eventually fade, and everything will be gone in about a few months.
Great.
Your skin, have you been sweating lately? Do you feel like perspirated?
A little bit, but nothing too extreme.
Okay. And for your activity level and diet, you're going to go home and not lift anything heavy, but after that, you can get back to normal. Everything will be fine. Just make sure as soon as you get home, you do not do any laundry or heavy lifting at all. Okay?
Sounds good.
Okay, and that's about it. I'm glad you're feeling better and good about your baby.
Thank you so much.